Welcome to Nursing Journey.
In this explainer, we are going to break down the essential skills of physical assessment. We'll cover everything from setting the stage and mastering the core techniques to those key exceptions, neural pearls, and of course, some awesome study tips. The goal here is to give you the confidence you need, not just for your exams, but for your real-world clinical practice.
All right, let's kick things off with Section 1, setting the stage. Now, this is a step that people often rush, but trust me, creating the right environment is the absolute foundation for a successful patient encounter and for everything that's going to follow.
You know, a truly successful assessment begins long before you even touch the patient. Just look at this table. Every single element of the environment matters. Privacy, that's not just about being polite, it's a legal requirement that actually encourages patients to share sensitive info. Good lighting? Well, that's a no-brainer for accurate inspection. But even things like the room temperature and noise level can affect your findings. You want to prevent shivering that you might mistake for a tremor, and you've got to be able to hear clearly during auscultation.
So beyond just the physical space, building trust really requires cultural competence. And this means understanding that things we take for granted, like direct eye contact, can be seen very differently across cultures. It's all about explaining every single step before you touch a patient, and always using a professional interpreter instead of a family member. And why is that so important? Well, because a family member might unintentionally filter or edit sensitive information, and that could lead to a really serious misdiagnosis.
And that brings us to a huge patient safety point that you will absolutely see on your exams. This isn't just a friendly suggestion, it's a hard and fast rule. Using the hospital's professional interpreter service protects patient confidentiality and, most importantly, it guarantees the clinical accuracy of the information you're gathering. It just makes sure nothing gets lost in translation.
Okay, so before we even get to the hands-on part of the exam, we need to understand the patient's story. And the old Cart's mnemonic is an incredibly powerful tool for this. It gives you this perfect, structured way to investigate any symptom, from onset and location all the way to aggravating factors and severity. It really ensures you don't miss a single critical detail.
Now that we've set the stage, let's jump into Section 2, Mastering the Core 4 Assessment Techniques. Think of these as the fundamental hands-on skills you're going to use in almost every single patient assessment you ever do.
First up, the most fundamental technique, inspection. And it's so much more than just a quick glance. It's a really deliberate process of using your vision and even your sense of smell to check for things like symmetry, color, and movement. Inspection always comes first because it gives you that pure, unaltered view of the patient before you disturb anything.
Next up is palpation, which is all about using your sense of touch. With your hands, you can assess everything from skin texture and temperature to organ size and tenderness. Two really crucial tips here. One, always warm your hands first for your patient's comfort. And two, always palpate any areas you know are tender last. This prevents the patient from tensing up, which would make the rest of your exam way less accurate.
Our third technique is percussion. This is where you tap on the patient's skin to create vibrations, and then listen to the sounds that come back. You can kind of think of it like sonar for the body. It's a really cool skill that helps you figure out what's lying just underneath the surface. Is it hair? Is it fluid? Or is it a solid mass?
So let's actually break down the sounds you'll hear. This table is so important. Resonance is that hollow sound you'd expect to hear over healthy air-filled lungs. But if you hear dullness instead, that sort of thud-like sound, that could point to fluid, like what you'd find in pneumonia. And tympany, that classic drum-like sound, is what you'll typically hear over an air-filled stomach. Mastering these sounds is absolutely crucial. And the fourth and final core technique is auscultation. This is where your stethoscope comes in to listen to those internal body sounds. Now remember, for high-pitched sounds like normal breath, vowel, and heart sounds, you're going to use the diaphragm. But for those low-pitched, often abnormal sounds like heart murmurs or brutes, you'll want to use the bell.
Okay, now for Section 3. We've just learned the standard IPPA order, right? Inspection, palpation, percussion, auscultation. But there is one critical, must-know exception to that rule, and that is the abdomen. Here, we change the order for a very important reason.
As you can see right here, the order for an abdominal assessment is inspection, then auscultation, then percussion, and palpation. Did you catch that? Auscultation jumps all the way up to the second spot, right after you look. This simple change from IPA to IAPA is so important for getting an accurate assessment.
So the big question is why? Why do we make this change? This quote explains it perfectly. If you start poking and tapping, palpating, and percussing, you can physically stir things up in the bowel.
This increases peristalsis and changes the bowel sounds. So if you listen after you've done all that, you're just not getting an accurate picture of the patient's true baseline bowel activity. You have to listen first.
Okay, moving on to Section 4, let's talk about some essential neuropearls. These are those high-yield neurological checks that you'll often integrate into your head-to-toe assessment. They can give you a really quick but incredibly valuable snapshot of a patient's neurostatus.
A fundamental neurocheck is assessing the pupils, and the best way to remember and document this is with the mnemonic PRRLA. This acronym literally walks you through the whole assessment, step by step, making sure the pupils are equal, round, and reactive to both light and accommodation. And remember, accommodation is just when the pupils constrict as you bring an object closer to the patient's nose.
All right, Section 5. This is all about helping you crush your exams. Let's go through some top-tier study tips and mnemonics to help you lock in all this crucial assessment info. First up, the Deep Tendon Reflex, or DTR, grading scale. You absolutely have to know this one. Our response is graded from 0, meaning no response at all, up to 4+, which indicates a pathological finding called clonus, but the key number to burn into your brain is 2+. That represents a normal expected reflex.
Now for a classic neurosign that can indicate meningitis, Brzezinski's sign. The mnemonic to remember it is super simple. Brzezinski starts with a B, so just think, bend the head. When you passively flex the patient's neck, if their hips and knees involuntarily flex up too, that's a positive sign.
And here's the other key sign for meningeal irritation, Kernig's sign. To keep it straight from Brzezinski's, just remember Kernig starts with a K, so think kick the knee. So when you try to straighten or kick the patient's leg out from a flexed position and they experience pain along their spine, that's a positive Kernig sign.
And finally, let's wrap this all up with Section 6, our key takeaways. These are the absolute must-remember points from our entire discussion on physical assessment. Okay, let's quickly summarize the must-know concepts. You absolutely have to master the correct assessment order. IPPA for most systems, but IAPA for the abdomen. You've got to know your neurosigns like Brzezinski's and Kernig's, understand that DTR scale inside and out, and be totally fluent in using tools like Old Carts and Perla. These are truly the building blocks of safe and effective nursing.
So we hope this review has helped you feel more confident. As you look at this question, we'd love for you to let us know in the comments which part of the assessment process you're feeling the strongest about now. Remember, mastering these skills is a journey, and every single assessment you perform is just going to build your expertise as a future nurse. Don't forget to like, share, and subscribe for more nursing content.